right. Good morning. As always, like to thank Jay and Vicky for interpreting this morning. Jay's got a new look today. I don't know if you guys are, I know everybody's watching Jay. What am I saying? Everyone's watching Jay. So he's got his new glasses on today. So now he can finally see what's being interpreted back to him by Vicky. So good news. Good news on the interpreter front. So we're going to start with the numbers as always. So as of this morning, we have 9,248 positive cases of COVID-19 in Hamilton County. Hospitalizations are at 933, and deaths are at 248. The increases from last week: for positive cases, it's 615. For hospitalizations, it's 48. And for deaths, it's 15. Greg is going to elaborate on these numbers. But in general, what we are seeing and what we have been seeing over the last couple of weeks is while we are at elevated levels for those metrics, positive cases, hospitalization, and death, elevated levels, but we've plateaued a bit and we're starting to move down the curve a bit. And Greg's going to go into this because it's the trends that are so important, particularly as it relates to hospitalization and deaths. For those of you, though, that are keeping track, and I may get this up on a chart, we're relying on Greg because Greg's got really good charts, so we're not doing our chart anymore. But for those of you that are keeping track, Scott Wortman, I'm talking to you right now, we have been talking about these changes from week to week. And so if you look at the hospitalization number, what if you remember, say on July 8th, we were at 44. July 15th, we were up to 52. The next week, we're at 50. We dipped down to 36, and now we're up at 48. So one would say, oh, wait a minute, we're on the rise when it comes to hospitalizations. Not the case, according to the metrics from public health and from the hospitals. What we think is happening with last week's number, we think that was an anomaly. It was a dip. We don't know if it was reporting lag or something else, but that we think was an anomaly. The 48 number from this week, from this change, is still a decrease from the trend. So I just want to clarify that for those of you that are really keeping track of these numbers from week to week like I am. All right. So we still have a lot of work to do. As all of you know, we're all doing this work together. We can't let our guard down. So we're wearing masks, safe distancing, constant hand washing. So these basic tools can and are making a difference in this community. So we have a number of updates this morning before I hand it over to Interim Commissioner, my bad, Health Commissioner Greg Kesterman for the numbers and the trends and some information that he has. But first I want to talk about kids, I want to talk about schools. So as many of you know, CPS originally had a plan where kids were going back in part in August. That has shifted. They are going to go virtual until September 28th at this moment in time. These are shifting dynamics. They're responding to what we know about the virus in the community. I do not envy the position of school board members. Thank you for being willing to do that work. It is difficult to navigate this, and families are counting on school board members and administrators in the school districts to give them good information and make good decisions. So thank you for doing that work. So the other school districts throughout the county are making their own policies. So it's not one uniform policy throughout the county. It varies district by district. But Governor DeWine has said that when kids do go back in person, students K to 12 have to have masks on. Obviously for the safety of the kids and their families who they go home to later on in the day. So what is Hamilton County doing in that space? Through our emergency management agency and with our PPE. So EMA, the Emergency Management Agency, has partnered with the Hamilton County Education Service Center, the ESC, to assist public and private K-12 schools in Hamilton County. So this is a partnership that is countywide, including CPS and all of the other school districts throughout the county. The partnership will provide 110 300,000 reusable cloth masks for kids, 350 no-touch thermometers, and 50,000 face shields as needed in schools in the county with the express need to the ESC. We are unable to procure masks for every single student in every district, but we are trying to make sure that if there is a child that comes to school and forgot their mask, if a mask breaks during the day, if a faculty member needs a mask, then those schools have a supply that they can give out in those situations. What I think we're hoping for is that parents are sending their kids to school with the mask already, or they're getting it through a supply that the school already has. But we're trying to step into the space. These are the CARES Act dollars again. These are those federal dollars that we got, and we're trying to utilize them strategically to help kids when they go back to school, depending on the district. So next, some pop-up information about pop-up testing throughout Hamilton County. We have a number of sites coming online within the next few weeks. At these testing sites, they're no cost. No appointment is needed. Anyone can walk in on the day that the pop-up site is scheduled in the various communities. A healthcare provider's referral is not needed. Quantities are limited, just primarily by way of time because they do shut down at some point. And so the advice is to get there early to make sure that you get the test. I actually went to one of these. It was a very long line. We did get tested, but it really was great, and it really didn't take that long. So today, there is a site, it's August 5th, from noon to 4 at the Forest Chapel United Methodist Church. This is in Forest Park. On August 12th, there's a pop-up at the Life Spring Christian Church in North College Hill. On August 19th, there's a pop-up at St. Mark AME Church in Springfield Township. And on August 26th, at the White Oak Christian Church in Coleraine Township. All of these sites and all of the detailed information, including addresses, can be found at the Hamilton County website, HCPH, Hamilton County Public Health. So I would encourage those that are listening to take advantage of that. When you go to the county's website for Hamilton County Public Health, you can also pull up a map and see where testing is going on every day throughout the county at a variety of sites run by either nonprofits, privates, publics. It's a conglomeration, but you'll see a map and it delineates all those sites. Call before you go. Next, some important news related to child care providers. As a refresher, at the start of COVID-19 public health emergency, the state of Ohio created a temporary license for child care providers who could stay open and provide services for first responders and essential workers, including emergency and healthcare workers. Many providers applied for the license and stayed open. However, for many, staying open came with a huge economic cost. The temporary pandemic license required changes to ensure the health and safety of kids and the providers, such as smaller classes, more teachers, PPE equipment, and extensive cleaning equipment and cleaning protocols. Hamilton County allocated $2.3 million in its CARES Act plan, so again, federal dollars, to assist those child care providers that operated under an emergency pandemic license and served low-income households. The goal of this program is to help maintain the financial stability of these critically needed service providers. As businesses and the community reopens, keeping Hamilton County's child care providers operating helps those returning to work find the necessary resources they need to do so. This is especially timely as we talk about kids going back to school. 4C for Children, a local child care education and advocacy agency, has been contracted to provide support services for the Child Care Provider Relief Program. Applications for cost reimbursements will be sent to 320 child care providers throughout Hamilton County. I have a lot of detail in front of me related to this program. I'm not going to go through all of that because I really do want to get to Greg Kesterman. So if you need more information, please go to the website for 4C. It is 4cforchildren.org. So it's the number 4, the letter C, FOR, for children.org. Yeah? Yeah? Okay. Thank you. All right. So with that, I'm going to turn it over to Greg Kesterman. One thing we asked Greg to elaborate on this week was the idea of trying to inform all of us, how the virus is spreading. So we were hearing things anecdotally about, well, it's spreading in this location, or it's spreading in this kind of business, or whatever. So I asked Greg to talk to some contact tracers, they are his contact tracers, to try to figure out what we're learning through the information we're getting for those that have contracted the virus. Because I think it can be really instructive as we move around, as we're out with our masks and we're trying to safely distance, to better understand how people are contracting the virus. So Greg is ready. I don't know if the information that he's going to provide is a surprise to anyone, but it is interesting. And so I appreciate kind of the homework that was done both by Greg and his team to help better inform how we can remain safe. So with that, Greg Kesterman.
Thank you, Commissioner, and good morning, everyone. So I'd like to start by saying that for the second week in a row, as I look at our numbers and our data, things are continuing to look positives. Now, this includes people out in the community wearing masks. I continue to see great compliance. The number of complaints we're receiving is continuing to decline on a weekly basis, and the actual data itself is looking very promising as well in many categories. The first slide I'll show includes the number of cases here in Hamilton County. You can see from my fancy graphic that I added where the masking mandate took place, which was about July 8th. And from there, even though there are some spikes in cases and some bumps along the way, generally speaking, we are continuing to see a decline in the number of cases here in Hamilton County. I am hopeful that this trend will continue and we will get ourselves back to where we were prior to this most recent spike. Over the last 2 weeks, over the last several weeks, we've also continued to see a decline with regards to the number of hospitalizations. In the top left graphic, you can see hospitalizations also decline. Often this does pair nicely with testing, although as we've talked about, the more tests you conduct, you do tend to find more cases. Hospitalizations is a true measure of what's in the community. So those numbers continue to decline. When looking at data put together by the Health Collaborative and Children's Hospital for the regional hospitalizations, these also are continuing to decline. Intensive care unit admissions for the region are also on the decline. Both are great indicators and very positive news. The bottom right graph on the slide is for deaths. As you know, deaths are a delayed indicator, and you can see several days on this graph where we were reaching 4 deaths per day in Hamilton County. This is not unanticipated. We were planning based on the hospitalizations as well as intensive care units admissions. We were expecting to see some increases in this indicator. Over the last 5 weeks, when you look at the reproductive value, on the next slide please, thank you, we are currently at 0.87 for Hamilton County, and when you look at the 14 county region, 0.97. You can clearly tell from both of those graphs that we have consistently over the last 5 weeks maintained ourselves under 1.0. Numbers above 1.0 means we're starting to see spread in the community, and when things fall below 1.0, it means things are contracting. Looking at a broad range of data in addition to specific indicators helps us paint a better picture when talking about COVID-19. And when I look at all of these indicators, overall, things are very positive. So I'm very happy to be able to share that. Commissioner Dreihaus just shared yesterday with regards to students K through 12 that masks are required. Our health district has been working closely with school boards, superintendents, and others to help make sure that they have the resources necessary. Masking has been a recommendation for quite some time. It is a great tool. We know not all young children will wear their mask perfectly, but it is a great start and an opportunity for schools to teach kids how to do so correctly. We know school boards are making decisions behind the scenes. I want to make sure that you know we're working with our schools to make sure they have the information they need. We have added additional contact tracers. We want to make sure that when we find a case within a classroom in a school, we're able to respond quickly and get the information necessary to isolate individuals within that classroom and do the recommended deep cleaning of that space so that we're not spreading the virus. We've also, at the request of many of our schools, updated our website, hcph.org. The website now includes age demographic data specific to school-age children, so you can see the 5 to 18 range, another helpful tool. And lastly, our environmental team has been working with schools to review plans and to make sure that they are going to open up in the safest way possible, which includes spacing and seating charts and things of this nature that will make our schools even more prepared. We must continue to remain strong and not let down our guard, and we have to keep working as a team to get through this. So I'm excited that there's a lot of work happening, and I'm excited that a lot of folks are coming together to make this happen safely. One area that we as a community must continue to improve,
I also want to
and you've heard me
apologize
say
for my
this
hair.
before, is our social distancing. It's important to social distance when you're around family and friends, when you're going to sporting events, or really any other type of gathering. Commissioner Dreihaus indicated that I'd share a little bit more about what we're seeing. We continue to monitor our data for trends and outbreaks. We're asking during our positive case interviews questions about if they've been to certain locations. We know that many positive cases in the 2 weeks, when we look at the data and we look at somebody who is positive, we know that in the last 2 weeks prior to becoming positive, they could have contracted that illness. So we're asking the question, in this 2-week period, have you been to shopping locations, retail locations, restaurants, bars, and other locations? And what we're finding is a large portion of the individuals or positive cases have gone to these locations, but it doesn't indicate that they contracted COVID-19 at this location. What we're finding is, at this point, COVID-19 is community spread. It is in our community, and people with COVID-19 are going out and about. So it's even more important right now that we continue to practice these social techniques, the hand hygiene, the social distancing, the masking that we've been talking about throughout the pandemic. Our epidemiologists look at this data, and we do try to find trends, and actually we're not seeing trends in which one location has been pinpointed and is causing community spread. It's all over. So next I'll touch base on testing. I have a nice graphic that our public information team has put together. This shows the testing locations in Hamilton County. Please visit once again our website. We do have a comprehensive list of all types of testing. If you're in a hurry for tests, there are opportunities to go no wait and get tested and have quick results. Please call before you go get tested at locations on our website so you show up prepared. I truly believe that here in Hamilton County we're making a difference. Most people are starting to wear masks and are doing so correctly. Please just remember that the way to wear a mask correctly is over your nose, over your mouth, and make sure you're doing so when you're inside locations, but also if you're outside. If you're in a crowded line waiting to go to the BMV, you need to wear your mask correctly. This helps show each other that we care. So lastly, wear a mask, stay home if you're sick, treat others with respect, and be kind as we work through this pandemic. Thank you.
Thanks, Greg. One point of clarity before we go to questions. So when I talked about the EMA, emergency management, working with schools, I just want to round that out a little bit. We're working with public schools, private schools, parochial schools, all schools throughout Hamilton County. If there is a school that is not connected, they can simply call the EMA, but I think it's a pretty robust effort, and most of them have been contacted to see if they need some equipment in those schools related to sanitizing and masks to help those kids in those schools stay safe. So, all right, Bridget, I think we're ready to go to questions.
So first up, Jay Hanselman with WVXU has a question for Greg, and then at least one for you, Commissioner.
Should we do mine first?
I was going to say, since Commissioner Dreihaus is there, why don't we take care of that one first? Good morning. I may have missed this. I know at one point you had reported that the March sales tax revenues were bad, but not as bad as expected. Do you have the numbers yet for April and May?
I don't have them on me, but we are making predictions as we do, moving into a budget cycle. So I will be happy to give those to you. Either I can report that out next week, happily doing that, or get you that in the meantime. John Brugan is our budget director. He has been busy at work providing us updates, so happy to do that. It is the other side of the equation that sometimes I think we lose track of, that we've got a reduction in sales tax and for the city earnings tax, and so we are still in this space where we are not generating the same kind of revenue we anticipated 6 months ago for this time of year. So I'll provide that next week.
All right, thank you. And then for Greg. Good morning, Greg.
Morning.
By my rough math, you're roughly a month into this mask mandate, and I know that you said the complaints about people wearing masks had declined. Have you had to take, or is it even possible to take any enforcement action with people complaining about people not wearing masks?
We have not. We have continued to follow the procedures that I've discussed on this process, or on this press conference, in which we update the business with a phone call initially. We go out and provide signs and masks. We are exploring additional options for enforcement for a few facilities that we've had difficulty with, but at this point we have not done anything further.
And at the beginning of the press conference, Commissioner Dreihaus reported 9,248 positive cases, and I think that's a cumulative number going back to March when the pandemic started. Can you, and I know you can only speak for your health district, can you say how many active cases right now your organization is monitoring?
I do not have that number readily available. I can check on that through our epidemiology division and report that number back.
Okay. And then you also mentioned about contact tracers checking for a student perhaps in a building or a classroom who tested positive for COVID-19. Is that a decision of the school district of how they handle that? Does that mean that they close down that building, or do you have some role in deciding what happens if there is a positive test in a classroom?
So our team will definitely be part of this process as we are opening up schools. We know that if there's a positive case of COVID-19, those same standards that we've talked about throughout the pandemic and contact tracing will hold true. So anyone that is known within 6 feet of a positive case would be required to be quarantined as a close contact. This includes in the school environment. So obviously the schools have a big role here to make sure they're maintaining seating charts and understanding who those students are around. In addition, we know that if we have a positive case in a school, there's some cleaning requirements that we're going to want to have happen. So if it's a younger child that stays in one classroom, we're going to look to potentially closing down that one classroom and doing a deep clean in that space. In addition, if it's say an older child that has multiple classrooms that they go to, I think that cleaning procedure and the extent of how many spaces need to be closed would be expand. But it will be a constant dialogue between my team and each individual school.
But it is possible that if there were, like you said, there were in multiple classrooms, could a building be shut down for some time while they do that cleaning?
Absolutely possible. We want to be the safest that we can be with our schools, and we want to be proactive and make sure that we're being upfront with the school districts and the parents as we work through this process.
All right, thank you. I appreciate it.
Sure. Commissioner Dreihaus wanted me to explain just briefly the jurisdiction for those that are not familiar with how public health here in Hamilton County works. So my agency, we serve 45 communities, townships, villages, and cities, all outside of the city of Cincinnati, Norwood, and Springdale.
So I asked him to, because this is gonna, the public health districts are different between the schools that are outside the city and the county, outside Springdale and Norwood, because they have their own health departments. And so the health departments with jurisdiction are the ones partnering with the schools. And Greg said this earlier, and I don't want it to get lost. Plans have been made in conjunction with the school districts and county public health and city public health to make sure that this isn't a random, we're going to open the school and hope that it goes well. This is a very planned opening where you've got the health department and the school districts working together on a plan to put that plan in place to keep kids safe in these schools. Now, that is not always going to work because we will have kids, they're kids, moving around outside maybe their safe space. So there are going to be situations where we need to take action to, like you said, close down a classroom or quarantine a child or perhaps more than one child. But the plans are in place right now anticipating these openings.
Next up, we have Scott Wortman from the Inquirer for you, Greg.
Good morning, Scott. One second, Scott.
Can
we can't
you
hear you.
unmute?
You hear me? Eventually, in a couple years, I'll get the hang of this. Hold on one second. Can you still hear me? I'm getting a weird prompt on my screen.
We can.
Okay, sorry about that. Couple questions. One, I just wanted to clarify the testing sites that you have on your website now. Is that part of that contract with the Health Collaborative, or when is that gonna? When are people gonna start seeing results from that?
So the testing sites on our website are currently maintained by our office and not related to the Health Collaborative's work. It's possible that as that work comes up and gets going, that we will partner with them and embed their information on our website. But right now, our website is maintained independently by us. So last week, Commissioner Dreihaus shared at their county commission meeting that the contract was executed. So over the next couple weeks, the final plans are being drafted by the Health Collaborative and their partners. And as soon as those plans are approved by the county, then testing will begin to happen, and we'll see significant increases throughout the remainder of this year.
You think that'll be this month that people will start seeing that, or next month, or any idea?
I think by the end of August, we will definitely start to see some testing.
And then, as far as
So in the interim, we've kind of partnered with the Ohio National Guard, and we wanted to make sure that we were providing additional access points for testing. And so we went to our communities and picked locations that we saw a need. And so we wanted to make sure that we were pairing nicely with this contract. Yep. So these pop-ups that Commissioner Dreihaus and I both shared, they fall in between the two testing, between the testing contract with the Health Collaborative.
okay. The contact tracers, you're hearing around the country, they're getting a lot of pushback, or people that don't want to reveal where they've been. They feel like that they're snitching on their friends, or they don't want to get anyone in trouble. Are you finding a lot of those obstacles? People reluctant to talk or reveal where they've been?
Generally speaking, we see really good compliance, but we do have instances where individuals are not willing to share. We have instances where people say they've not been around anyone but a boyfriend or a girlfriend, and that's it. And we have suspicions that there might be other individuals, but we can only rely on the information we are being provided. In some instances, I know contacts are indicating that they will handle it on their own, and my team has gotten very good at being persuasive, and often we're able to still have them share this information. But once again, we are only able to operate on what information they're providing.
So, how confident are you that the information you're getting is accurate or thorough enough?
I would say in almost all cases, we're getting very accurate information. At the end of the day, everyone understands how important COVID-19 is to dealing with and addressing. And if people want to get back to normal this fall and beat COVID-19, they have to work with us. And I think that message is out there. And so I'd say overall compliance has been very good.
One final question, this might be for you or Denise. I just wanted to clarify, and I apologize if I missed it earlier. The PPE for the schools, is that for only school districts in the county's jurisdiction, or is that also Cincinnati Public Schools? Or I apologize if I, again, didn't catch that.
It's for all of the above. It's Cincinnati Public, it's the school districts outside of the city, it's private schools, it's all schools throughout Hamilton County, including the city, Norwood, and Springdale.
Okay, thank you. All right, that's all I have.
Thanks.
Our next question comes from WCPO's Courtney Francisco for you, Greg. And Greg, can you tell us where people can get fast results and what the average wait time is for results, and how many people are getting tested each week?
So my understanding with relationship to the speed of testing at the pop-up sites, I believe it's from 3 to 7 days for test results. Those numbers have been improving, and so hopefully this time when we do testing starting today, we'll see some even quicker results. If you need results quick because of travel or some other plan or a workplace requirement, I recommend using our website. and calling locations in advance. Several private labs have much better turnaround time as they are using resources not within the county.
Okay, and that appears to conclude our questions from reporters.
All right, well, a bit of a ping pong effect here today with myself and Greg. Jay, as always, is the constant. So thank you again, Jay and Vicki, for doing this week after week with us. We really do appreciate it. And the whole team that's behind the scenes that you guys can't hear. A bunch of young people that know something about technology. So it's always good to have a good team. So thank you all for tuning in. We are shortly, I don't know if it's next week or the week following, going to start talking about the small business. Remember, we're rolling out a second phase. So the small business assistance is coming back, new and improved. And so we'll have some detail about that and some stories about some of the business that have been helped. I think we have heard some of the stories ourselves internally, and it's really inspiring when someone has been able to keep their business open because we were able to help them with a loan. So or rather a grant. So it's really good. So anyways, stay safe, wash your hands, wear a mask. Oh, one other thing, quickly, Greg, you said it. So everybody wants to get their kids back in school, I think, safely. Everybody wants their kids to start playing sports again. Everybody wants the drama classes to start again so the plays can go on. Everybody wants to go to the Reds games, the Bengals. We can only do this if we're doing what we know we need to do to keep safe. So wear the mask so that we can get to a better normal and start to have some of these things open up and we can go out and see one another. So anyway, thanks for what you're doing. We appreciate it. We'll see you next week.